Hello, you are welcome back to part 2 of our series on logistics management system in the health sector. The last time we talked about the part 1, and I encourage you to search for the part 1, and you can have the privilege of listening to all the details. Today on this part 2, we will be discussing or focusing on 3 key areas. But as a recap of what we did in the part 1 so that you can flow with the part 2, you would remember that part 1 we learned that logistic management is about efficient flow and control of health commodities. We also learned that it faces real challenges such as poor infrastructure, forecasting errors, and policy issues. We also learned that it succeeds only when the key elements, which include procurement, storage, transport, and disposal, work together in harmony. Today, we move to the part 2. And in the part 2, we will be focusing on essential data collected on LMS, basic elements of inventory management in LMS, that is your logistic management information system. And number 6, we'll be looking at inventory control and purpose. Inventory control and purpose. I am Dr. Henry Aisaboy, and in this session, we will dive deeper into data and inventory side of logistics. What I like to call the brain and bloodstream of the logistics system. Why do I say that? Because if the logistics flow is the heart that pumps supplies through health system, then data and inventory management are what give it life. They help us to know what to order, when to order, and how to control waste. So let's start with the first aspect, essential data collected in the LMS. Essential data collected in the LMS. Here, every functional logistics system depends on data. Without accurate data, decision-making becomes guesswork. And guesswork in healthcare leads to shortages, waste, and inefficiency. The logistics management information system collects data to support planning, forecasting, and decision-making. Let's look at the essential types of data that it captures. Number 1, stock levels, consumption patterns, order history. For stock levels, this refers to how much of each item is currently available, what has been issued, what has been received, or what has been used. It also talks about stock level data because it helps prevent stockouts and overstocking. For example, if the logistics management information system shows that a facility has only 2 weeks of anti-malaria drugs left, it triggers a reorder before the stock runs out, because that is the minimum stock level. It will inform you, trigger that reorder, so that the process of acquisition will start. The second aspect, consumption pattern. Remember, we are looking at the essential data that are collected on the LMS. Consumption pattern. This tells us how fast commodities are being used based on maybe daily, weekly, or monthly consumption. And it helps us in forecasting future needs accurately. For example, if a clinic uses 100 rapid diagnostic test kits every month, and the catchment population is increasing, the LMIS should anticipate a proportional rise in usage over time. So that's what consumption pattern brings to the table as an essential data that is collected on the LMIS. The other aspect, order history. The other essential data. Order history gives insights into what was previously ordered, when it was ordered, and in what quantity was it ordered. It allows for trend analysis, and it helps managers understand seasonal or program-specific demands. For instance, more insecticide-treated nets may be ordered in malaria endemic regions before the rainy season because demand actually peaks at that time. Once the rain begins in the rainy season, more demand will be observed for the insecticide treated nets. Let's move on. We have the supplier performance. Now, this is often overlooked, but very important. The LMIS tracks supplier timeliness. It tracks the quality of goods that the supplier has been supplying over time and how reliably those goods have been. Why is this crucial? Because a supplier who delays deliveries or sends substandard items disrupts the entire chain, and that can endanger the life of somebody in dear need of that supply or that commodity or that drug or that reagent at that time. So data helps managers decide whether to keep or replace that supplier. Distribution trends. Distribution trends, that's another essential data. This data monitors how commodities move across different healthcare locations. It helps ensure equity, that all facilities from urban to rural receive fair distribution according to their needs. We see the next one, losses and adjustments. What does this mean as an essential data that must be collected on the LMIS? This covers what is lost due to either pilferage, damage, expiration, or discrepancies during stock count. During stock count, these things are experienced. You either see a reagent or a particular commodity that is damaged or expired, not demanded for, and it got expired. So recording these losses ensures accountability and helps improve storage and security measures. So, to summarize these aspects that we have looked at, LMIS data must include stock levels, consumption patterns, order history, supplier performance, distribution trends, and losses or adjustments. Together, this provides a complete picture of the logistics health of any systems. You can see an overflow of the LMIS unit. You can see the director, the LMIS coordinator, the unit supervisor. These are the data entry personnel. So you have somebody in charge of the process forms, somebody in charge of the monthly status reports, You have somebody in charge of the quarterly feedback reports, quarterly pipeline reports, data for contraceptive consensus forecast, data for annual commodity distribution program. All this data comes in to the LMIS to help the director or the coordinator form a shaped report that is comprehensive, evidence-based, and can be applied. LMIS data collected at the health facility. You can see malaria, family planning, essential medicine, hospital extra supplements, ARV, HIV treatment drugs, other drugs, laboratory reagents, tuberculosis, and all that, the drugs, and so many. You can see the opening balance, what was received, what was lost or adjusted, closing balance, maximum and minimum stock, quantity needed by, different departments, the patient data, and all that. These are, just a look of what the data looks like. We'll move to the next slide, which is basic elements of inventory management in LMIS. Basic elements of inventory management in LMIS. Now, let's move into inventory management proper. A critical aspect of logistics inventory management is all about maintaining the right balance between too much and too little. Remember that in logistics, balance is everything. So let's discuss the basic elements of effective inventory management. We will look at them one by one. What are the basic elements of effective inventory management? So we'll look at the first one, optimal stock levels. We'll look at the second one, categorization of items. We'll look at the third one, reorder points and lead times, storage practices, proper documentation. So let's look at these basic elements that guarantees effective inventory management. So I start with number one, optimal stock levels. This means holding enough stock to meet demand, but not so much that it ties down capital or expires on the shelf. It's about balancing availability and affordability. For example, if a faculty holds a 6-month supply of syringes, but uses only half, the excess could expire or take up space that could store other items. Hence, an optimal stock level planning is very important so that such a situation does not arise. Number two, categorization of items. Here we use classification systems like ABC, VED, and FSN analysis. Now we'll look at them one by one. For the ABC, always better control. It classifies items by cost. A items are high value and they need strong control. The A items are high value items and they need strict control. While the B items are moderate and the C items are low cost. So, I repeat, the A items are those ones that are of high value and they need strict control. The B items are moderate and C items are low cost. Let's look at the VED. The VED is where categorization takes place by criticality based. In other words, you have vital, essential, desirable, VED. What is vital? what is essential, what is desirable. So classification here is based on criticality. Vital items must never go out of stock. Vital item must never go out of stock. The other category is that, okay, these ones are essential, while the other ones are desirable. And the third categorization is FSN. FXN, that is in order of categorization of items. You know, this is movement based, and we call it fast, slow, non-moving. Fast moving items, slow moving items, non-moving items. Based on how fast items are used or issued, these items are categorized. So those ones that are quickly used, fast moving are categorized in one section. Those ones that are slow in ordering, collection, or the request for them slowly, they are put in one particular section, and the ones that are non-moving in one section. For example, oxygen cylinders. This is vital and fast moving, so they require high priority in monitoring. Oxygen cylinders, they are vital, they are fast moving, so they require high priority in monitoring. Number 3 is reorder points and lead times. This determines when to reorder and how long it takes to receive items after ordering them. If it takes 30 days to get new lab reagent, you must reorder at least a month before running out. That's the lead time principle. So, if you know that it takes 40 days, 50 days to get a new lab reagent when you order them, then you must have made your reorder at least a month, 50 days before running out, so that by the time this one is running out, the current batch, the new batch will come in. And that is what we call the lead time principle. Failure to calculate this leads to dangerous stockouts. If you fail to calculate it, if you fail to monitor it, it will lead to dangerous stockouts. And imagine when the oxygen tank is not available, you experienced a stockout. That is disastrous. Number 4, storage practices. Good inventory management also depends on proper storage, and this includes applying what you call the FIFO, first in, first out, meaning the oldest stock is used first to prevent expiration. The oldest stock is used first to prevent it from expiring. So in healthcare, the FIFO, FIFO, is not optional. It is mandatory, especially for vaccines, reagents, and drugs, because they have a shelf life, that's an expiry date. So you have to use them according to the number of months. That is, you offset them, or the oldest stock, use them quickly before it gets expired. And the last but not the least under this basic element is the proper documentation. Every transaction should be traceable. That's why we use bin cards in logistic management system in our storehouses. That's why we use stock identification cards, issue vouchers, and even stock ledgers. Bin cards, stock identification cards, issue vouchers, and stock ledgers. Documentation not only ensures accountability, but also supports audits and reviews. Both accountability it ensures, and it will help you so that you can do a good audit and you can carry out a good review. So, as public health managers in the making, as public health students with a vision to become great managers in the future, always remember that an undocumented transaction is an unverified one, because there's no way to be verifiable because it was never documented. So, proper documentation is key. So you can see the inventory management process. Number one, data is collected. Number two, you build ID method. How do you categorize them? Number three, you choose a system. Pick the inventory management system that meets your unique needs. And number four, utilize software that you consider automating the process with an inventory software, which is usually the program inside the LMS. We also see the benefits of inventory management. Here you can see appropriate stock levels, on-time delivery. On-time delivery. You see satisfied customers because everybody is happy. The laboratory, the pharmacy, the surgical theater, everywhere, they are happy. The patient that is being treated are happy because they don't come and hear that results are not ready, drugs are not available, surgical procedures cannot take place because this and that, what they need is not available. You also have reduced wastage as a very huge, benefit of inventory management. And finally, improved operating cost. No waste anywhere, no money is tied down anywhere. Having said this, we'll now move to slide 6. Inventory control and purpose. And under the purposes, we'll look at avoiding stockouts, minimizing carrying costs, reducing wastage, streamlining operations. Now that we have discussed inventory management, let's talk about inventory control, which is more about discipline and regulation. Inventory control means systematically managing what's in stock to minimize waste, optimize resources, and maintain smooth operations. We will see the purposes of inventory control, like I've read out 4 of them. Number 1 is to avoid stockouts. This is the most obvious purpose, ensuring essential commodities are always available. A stockout of essential drugs can cripple healthcare delivery. Number 2, minimizing carrying costs. Keeping too much inventory locks up money and space. Effective control minimizes these costs, and it allows funds to be used elsewhere. Number 3, reducing wastage. Through proper monitoring, items are less likely to expire. They are less likely to deteriorate or be stolen. That's why periodic stock checks are very, very essential. Number 4 is streamlining operations. Inventory control helps ensure supplies are available, exact when needed. That is, exactly when these stuffs are needed. Streamlining operation will ensure that these supplies are available exactly at that time. And this will promote smooth workflow and better patient care. Because if at point A, this particular item or supply is needed, but it wasn't available at that time, then it will distort the process of healthcare and put the life of patients at risk. Now, Let's us see inventory control best practices. As you can see here, create an organized floor plan, digitalize your operation, implement cycle counting periodically, use clear label and signature, choose the right inventory control method, make a marketing and sales plan. This is just the summary of inventory control in terms of best practices. Now let us see types of inventory control techniques. You have the ABC analysis, you have the VED analysis, which I already talked about, but we'll look at it again in more detail. And then we have the FSN system, and then you have the XYZ analysis. Let's look at them quickly, just an expansion to what I've said in the past. ABC analysis. Remember, we want to explore the analytical methods commonly used to classify and control inventory. What has been supplied? How do we classify them? How do we control them? Number one, ABC analysis. Based on cost. That's ABC analysis. This kind of method is based on cost. For the A items, example, the MRI spare parts, they are high value and tightly controlled. High value and strictly controlled. The group B items are moderately controlled. Moderately controlled. They are medium cost items. While the C items are low cost and need minimal control. They are low cost and they need minimal control. Number two is the VED analysis, and this method is based on criticality. It is based on criticality. Vital items are life-saving and must always be in stock. Essential items, essential items are necessary but not critical. D, desirable items can wait if resources are tight. So, vital items, these are life-saving and must always be in stock. Essential items, they are necessary but not critical. Desirable items can wait if the resources are tight. We look at the third one, FSN system or FSM analysis. This FSN analysis or system or this method is based on movement, where you have the fast moving items because they are used frequently. Then you have the slow moving items that are used occasionally. You have the non-moving items that are absolutely, or that are obsolete or expired. They are not used. They are expired, they are obsolete, and so they are non-moving. So you categorize them properly during your inventory control so that you know which is which and we don't mix them up. And finally, the XYZ analysis. This is based on value of stock held. The XYZ analysis based on value of stock held. The XYZ analysis or method helps track high value items that tie up large capital, even if they are not used frequently. But you find them in the store and they tie up large capital. It will help you to be able to know or track such high value items so you don't miss them or get them lost or stolen on the long run, because these particular commodities, they are of high value, but they also tie up a lot of capital, which is you use a lot of cost, a lot of capital to be able to get them. but they are not used frequently, just periodically. So you have to put an eye on them so that we don't miss them. So let's have a recap on part 2. We've seen from part 2 that LMS data tells us what's happening in the supply chain. It tells us what is going on in the supply chain from stock level to supplier performance. We've also seen inventory management. We've seen that it helps us to maintain balance, avoiding both shortage and waste. We have also seen inventory control. It ensures discipline using methods like ABC, VED, and FSN analysis to guide decision making. So you can see on your screen, inventory control. Take note of all this. They are important, just like I've explained them. You can also see purpose of an inventory control system to determine when stock should be ordered or issued, to determine how much stock should be ordered or issued, and to maintain an appropriate stock level, as I've earlier said, on all products, avoiding shortages and oversupply. So that will be all about part 2. If you understand these 3 areas that we've talked about, LMS data, inventory management, and inventory control, then you are already understanding 60% of what keeps a healthy logistics system alive. In our next session, which will be part 3, we will move into procurement, product selection, and forecasting. And you will learn how to anticipate health commodity needs and ensure continuous supply, a skill every health manager must master. And this section focuses on 3 vital operational pillars. That's the part 3 that we'll be studying next. Number 1, the principles of procurement, the product selection, forecasting, and quantification. Until then, please review your notes and remember that in public health logistics, data is not optional. It is oxygen. If you love this video, please like, subscribe, and share it to your friends. Thank you, and I'll see you in the part 3 of this series. Bye.